The pain was basically in my right leg. It went all the way from my thigh on down. It was like electricity. There was absolutely no relief. It was constant. I had trouble rolling over in the bed because of the leg. I had to pick it up and roll over. I couldn't walk down the street. I used a cane to try to help. I was afraid to drive. I just got to the point I didn't want to even try. I didn't want to go out. So I just stayed at home.
I first met Linda in May of 2016, and she came in for a new patient consultation. She had tried physical therapy, she had tried pain management, she had tried pain medication, she had tried multiple lumbar injections.
There was no pain medicine that would do any good.
She had a very difficult, complex problem with her back. Number one, she had scoliosis, which is a curvature and twisting of the spine. And she also had something called spondylolisthesis, so the last two vertebral bodies had actually slipped. The L5 vertebral body had slid forward on the tailbone or the sacrum. And both of those things contributed to pinched nerves in her back. And that was essentially the cause of the pain going down her leg. The procedure that we decided on was a fusion. The goal of her fusion at L5-S1 was to relieve the pressure of the L5 nerve root, and that's one of the nerves that makes up the sciatic nerve and was the cause of her pain going down her leg.
I couldn't wait to have it. Everybody but the maintenance man checked me out. I mean, it was phenomenal. I mean, I had an interview with his PA, I had an interview with the vascular surgeon, I had an interview with the nurse doing the pre-op, and I thought, you know what, this man is not going to touch me until he knows exactly where he's going and what he's going to do.
Because of her unique anatomy, I decided to perform a fusion with the robotic system, with Mazor Robotics. And the benefit of that was we could use a CT scan of her unique anatomy to plan where we were going to place instrumentation and eventually screws for her procedure. And that's really key with somebody like her with unique anatomy. Not everybody's anatomy in the low back is the same, and so specifically in this case, the robotic system allowed us to accurately place hardware in the safest way possible.
There were no surprises going in. He had explained everything, and I just went with anticipation of waking up from that procedure and not hurting. And that's exactly what happened.
Linda did great post-operatively. She had a very short hospital stay, and I remember those early interactions with her after surgery, just how quickly she noticed that the pain down her leg had gone away.
When I got up to walk, there was no pain. I cried. Not because I hurt, but because I was so thankful. Life is different because I want to get out, I feel good. I can walk. I had not walked my neighborhood in over 3 years. In the beginning of November, when everybody started putting out their Christmas decorations, I couldn't wait to get out and walk and look at everybody's decorations. It's 1.25 miles around my neighborhood. I would stop at my sister-in-law's on the way back, have a glass of wine, and then come on back, and I thought, this is just the most wonderful thing that's ever happened. I want people to remember that I got my life back. The very first text I sent to my daughter was my husband and I dancing. And she wrote to me and said, "Mama, I am so glad that you're out."